I don't know if you've ever been there when someone's overdosed, but they start to make a horrible noise. It's the kind of noise where they can't breathe. They call it the death rattle. That's what it's known as, the death rattle. What's the matter with him?
He's a little bit mashed.
What, I think he might be a bit more than mash, you know. John! John, mate, open your eyes, mate. Open your eyes.
John.
Yeah, John,
wake up. You better phone an ambulance, mate. The pupils will be very smart.
He was absolutely white, like a milk bottle. His lips was blue, his skin was white, all sticky and clammy. First of all, we thought he was dead.
What you tend to find is that the person will become unconscious. They may look very, very pale. The lips may be blue, and they may even be blue. You could try arousing the person by shaking them or pinching their ear. They may not respond to that. You may, want to try to just give them a slight slap, see if they will come round if you slap the face, say. But if they're not responding, then that is perhaps a sign that somebody has taken something that has caused them to go into unconsciousness.
When a person be ODing, they happen to turn different colors, like dark blue or dark purple, like, and their lips turn their color. Their eyes go into the back of their head, and that white stuff come out their mouth. And they start shivering all over.
And she OD'd. I mean, she just went out. And it was like, the lips were turning blue, she wasn't breathing, she was going, her eyes were fluttering. She was just going in and out, and I could tell.
You know that they're gone, or they're leaving.
And next minute, you're waking up, and you're a little bit disoriented of what's going on around you.
I was scared. I didn't know what was really going on, but I knew they were dying.
I remember saying, Dennis is good.
I know back in the old days, there's a lot of work. Some people would shoot them up with milk, sugar water. I've seen people try to shoot them up with salt water. My philosophy was I used to almost beat them silly, beat them black and blue, keep them up, keep them from falling, rub them in the snow, drag them on the snow or ice water, something to keep them from going further into their knot. It was a lot of work. Thank God for Narcan.
It's important for me to dispel the myths about opiate overdose. Putting a person in a cold shower or putting ice down their pants is not going to revive the person. Inducing vomiting will only make them choke. A drink of water or caffeine will not help. Slapping or kicking or moving someone around is not going to help them. The fact is, a cold shower or bath will only lower someone's body temperature or cause them to drown. Giving the victim a drink or inducing vomiting will only cause them to choke. Slapping or kicking the person may only just cause them more harm.
Step 3. Give rescue breathing.
So after you give them the sternum rub and you stimulate the person doesn't respond, you want to get oxygen to the person. You do that with mouth-to-mouth, rescue breathing. You first want to check to see that the person doesn't have anything down the throat. So you want to clear the throat if there's anything in there. So you first want to check. Then you lift the neck like that, so you have an open airway. You put the mask on. What you want to do is put your hand right on the forehead, and you pinch the nose closed so the air doesn't escape through there. Hold right here and breathe twice hard the first time to a quick breath. Wait 5 seconds and then give another breath. Then count to 5 and give 1 breath. Keep going like that.
Many times people have been revived just from the oxygen. Just from oxygen being breathed into them, they begin to breathe themselves and come to. If they haven't, then that's when we need to use, our training in terms of the Narcan.
Step 4. Give Naloxone.
One way Naloxone comes in the kid is an injectable type of Naloxone. So the first thing we do when we're going to give injected Naloxone is put our gloves on. Grab the syringe that's in the kit. Uncap it. Take the Naloxone vial. Uncap that. pierce the membrane, and just pull up the entire content of the medicine into the syringe. Okay, like that.
It's a muscular injection, which means the shoulder or the thigh, just like if you would give a flu shot.
So you could actually administer the shot right through a person's clothing. I said, you don't have to roll up their sleeve or anything. You don't have to get a vein. You go ahead and just get it right into the muscle.
Remember, at this point in time, it's a life or death situation. So you definitely want to just provide the person with the medicine. So we're going to use your shoulder, right? So basically, you want to go to this area right here with a jabbing motion like that, and then inject the full amount of the medicine, of the naloxone.
There are two ways you can give Narcan: muscular injection or nasal spray.
Okay, another version.
A is for airway. You need to make sure there's nothing obstructing someone's airway. R is for rescue breathing. Rescue breathing involves tilting the head back,
pinch off their nose, seal your mouth over theirs,
breathing twice,
I don't know.
And then once every 5 seconds for someone watching their chest and abdomen rise. E is an evaluation step. Can you keep this up indefinitely?
Okay,
How is the person doing? Is their color getting better? Are you breathing for them successfully?
M is for muscle.
Should I get a shot of naloxone?
Yeah.
1 cc intramuscular injection of naloxone.
You take the needle and you stick it into the bottle and you draw up 1 cc.
Each of these syringes have 1 cc in them. These 2 syringes are half cc, so you would have to inject 2 of these in order to get 1 cc. 100 units in an insulin syringe equals 1 cc. Problem with these syringes is that the points are too small. If you have to use these syringes to inject naloxone, you should inject it into the tongue. But the best syringes to use are these. Points are all 1 inch or more, which is easy to get into a muscle.
In the shoulder, in the thigh, or in the booty.
1 cc just goes to the 1 on each of the syringes.
Don't spend your time fumbling for a vein. The seconds count here.
Let's start with common risk factors for overdose. Low tolerance after periods of abstinence, such as treatment, incarceration, or just a relapse. 3 days of abstinence can be enough to lower tolerance and increase the risks of fatal or non-fatal overdose. Another risk factor is a change in purity or past overdoses. If someone has overdosed previously, that increases their risk. Physical health. If they have Hep C or the flu or bronchitis, brings their body's tolerance down, puts them at risk. Heroin-laced fentanyl, speedballing, which is a mixture of heroin and cocaine, and also alcohol. Isolation and using alone. Many times parents will pick their kids up from treatment or incarceration, and their kids will be alone in their room and they think they're okay. This is a common time for somebody to relapse, and just because they're home does not mean that they're safe.
Great. If you're opiate dependent, stopping your using for even a few days increases your risk of overdose. Mixing alcohol and or cocaine or pills with heroin increases your chances of overdose.
A person is overdosing if they're hardly breathing or have stopped breathing altogether. They're turning blue or gray in color. They don't respond when you give them the sternal rub. So what do you do when someone overdoses? First, give sternal rub. Second, call 911. Third, give rescue breathing. Fourth, give naloxone. Fifth, Continue rescue breathing for 3 to 5 minutes. If the person isn't responding, give the second dose of naloxone. Naloxone only lasts 30 to 90 minutes. Even though the person will feel sick from withdrawal, don't let them use more drugs. Stay with the person until help arrives. If they start breathing, lay the person on their side.
Michael! 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 Okay, come on, man. Mm-hmm.